Our next inductee is well known throughout this state, Governor Phil Bredesen. Phil Bredesen served as mayor of Nashville from 1991 to 1999 and as governor of the state of Tennessee from 2003 to 2011. As governor, Bredesen revitalized TennCare, which today remains a nationally respected model of state Medicaid. He led significant public health and enforcement efforts to address the state's methamphetamine crisis. He initiated successful public health efforts to reduce teenage smoking and infant mortality, and he instituted state programs to provide health insurance for uninsured adults and children and to assist with prescription drug costs. Bredesen has been instrumental in developing Tennessee's presence in the private sector healthcare as well. He found and ran Health America, an NYSE-listed HMO company with 6,000 employees, and he later founded Coventry Corporation, now part of Aetna. He's been active in his community outside of government service as well, founding Nashville's Table, a nonprofit organization collecting unused food from local restaurants, hotels, and grocery stores, and the Land Trust for Tennessee, which has preserved 130,000 acres of sensitive land in our state. Governor Bredesen has led a life of public service and unwavering dedication to the well-being of his Tennesseans. Please welcome Chad Campbell, the Regional President of Grand Sponsor Community Health Systems, to present Governor Bredesen with his award.
Thank you very much. I am honored to be here in this wonderful space. And Bob, I don't know why you couldn't have made something a little bigger and more well-appointed than this, but it really is an honor for me to be, first of all, included in the Hall of Fame, but especially to be in the company that I am today. It's a sobering experience. I really appreciate and like the way in which the Hall of Fame has a mix of people that is honored. People on one hand who have been the providers of medical care, the researchers who've done the science, the people who've actually done the hands-on work, and of course Belmont is training a whole new generation of them, but also some of the people who organize it and put it together and make it work. As I've learned during my time in this field, the frontiers in healthcare today, they're moving away from being the scientific and the technological frontiers, and I think more into the soft side of things. Of we have this wonderful science, how do we get it into the hands of people? How do we let people access it? How do we take this complicated system and make it into a more holistic one for the benefit of patients? You know, things like problems we have in this country with infant mortality. It's not the science. We're the best in the world by far on the science and technology. It's issues of access and doing a good job of bringing to bear all that knowledge and expertise that we have. So I just wanted to say, as I say, thank you. I hope that the Hall of Fame will continue to honor both sides of this equation, not only the wonderful people, especially in these past couple of years, who actually provide the care, who provide the science behind it, but also those who work to connect all that science with the need of America's citizens. Thank you.